Have you noticed subtle but concerning changes in a loved one over the past year? Many assume that death in old age comes suddenly, but in reality, the body often gives quiet, early warnings. These signs can begin appearing months, sometimes even a year, before the final stage of life. Unfortunately, they're easy to overlook because they often seem minor at first. It's only in hindsight that families recognize the clues that were there all along. By then, it's often too late to prepare or create those final meaningful memories. In this video, we'll explore 5 key signs that often emerge in the year leading up to an elderly person's passing. Some of these may be things you've noticed but dismissed as normal aging. Others might appear minor but are actually indicators of the body's gradual decline. Recognizing these changes early can help you offer better care, create cherished moments, and most importantly, ensure your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end. These 5 signs can help you prepare emotionally and practically for what lies ahead. When you understand what's happening, you won't be caught off guard. You'll be better equipped to make the most of the time you have left with those you love. Number 1. Significant weight loss. One of the earliest and most telling signs that someone may be nearing the final year of life is unintentional weight loss. At first, it may seem insignificant. A belt that suddenly needs tightening, looser clothes, or a fading appetite. Often, families brush this off as a normal part of aging. But the truth is, unexplained weight loss is rarely harmless. It often signals that the body is no longer absorbing nutrients properly. Muscle mass begins to decrease, and key bodily systems start to slow down. While some muscle loss is natural with age, rapid or noticeable changes suggest something deeper. The body may be having trouble digesting food or processing protein, leading to muscle wasting. This loss of strength not only makes daily movement more difficult, it also increases fall risk, weakens the immune system, and raises vulnerability to infection. Another reason for this decline is a change in appetite. Many elderly individuals simply don't feel hungry the way they used to. Their sense of taste fades, food becomes less enjoyable, and they may begin skipping meals or eating only tiny portions. This isn't just personal preference, it's a physiological shift. As the body begins to slow down, it stops sending hunger signals to the brain. The result is less energy, less strength, and overall decline in health. Chronic medical conditions also play a role. Diseases such as cancer, heart failure, and kidney disease can begin progressing long before more obvious symptoms arise. Even conditions like depression or cognitive decline can reduce appetite, triggering a downward spiral where the body simply isn't getting the fuel it needs. Families often respond by offering favorite meals, encouraging eating, or adding protein supplements. But if the weight continues to fall despite these efforts, it's important to recognize that this may not be a dietary issue. It may be the body preparing for a deeper transition. At this stage, large meals aren't always helpful. Instead, focus on comfort, hydration, and easy-to-eat foods to help maintain quality of life. If you notice noticeable weight loss, especially alongside weakness or decreased activity, it's time to pay close attention. This isn't just about physical changes. It's the body sending a message. And understanding that message now allows you to support your loved one with clarity, compassion, and intention. Number 2, extreme fatigue and weakness. Another common and more visible sign during the final year of life is deep, persistent fatigue, a type of exhaustion that doesn't go away with rest. This isn't just feeling a bit tired after a long day. It's an overwhelming, constant lack of energy that makes even basic tasks feel too difficult. Getting out of bed can become a struggle. Walking across the room feels like a major effort. Simple daily routines like cooking, dressing, or even talking may become too draining to manage. This isn't just about aging. It's the body's way of conserving its limited energy. As organs begin to slow down, the body focuses on essential functions. The heart pumps less efficiently, circulation weakens, and oxygen levels drop, all contributing to feelings of weakness and unsteadiness. Metabolism also slows significantly. The body shifts from energy production to energy preservation. This is why many seniors nearing the end of life sleep more, nap during the day, and find it harder to stay awake. Some may even have sudden drops in energy, feeling fine one moment, then completely drained the next. There's also a profound emotional impact. Seniors who were once active and independent may feel frustrated or embarrassed by their limitations. They may begin to withdraw from socializing or stop engaging in activities they once loved, not because they don't care, but because they simply don't have the energy. This can lead to isolation, which often accelerates their physical and emotional decline. For families, watching this change can be heartbreaking. It's easy to misinterpret fatigue as laziness or think a loved one just needs motivation. But forcing activity won't help. What's most important is honoring their limits, allowing rest, and focusing on comfort rather than productivity. If you notice that your loved one is increasingly fatigued and rest offers little relief, understand that their body is undergoing a major transition. This is the time to offer companionship, peace, and support, not expectations. What matters most now isn't how much they can do. It's that they feel loved, respected, and safe. If you're still watching this video and finding it helpful, please comment number 2 below to let us know you're here. And if you haven't already, consider subscribing and turning on notifications so you don't miss our future videos. Your support helps us continue creating meaningful, supportive content for families like yours. Now, let's move on to the next sign. Number 3, increased cognitive confusion or withdrawal. As a person approaches the final stage of life, one of the most striking changes can be seen in how they think, communicate, and interact with others. You may notice that someone who was once sharp and engaged starts to forget things more often, struggles to follow conversations, or seems disoriented in familiar places. They may repeat themselves, forget names, or lose track of time. Even when they never had memory issues before, these subtle cognitive changes can happen months or even a full year before death. This isn't just everyday forgetfulness. The brain, like any other organ, requires a steady flow of oxygen and nutrients to function properly. But as circulation weakens and oxygen supply to the brain decreases, cognitive function starts to decline. The person may become easily confused, have difficulty making decisions, or struggle to recognize people and places they've known for years. In some cases, they may even have brief moments of lucidity, followed by sudden episodes of confusion, almost as if their mind is fading in and out. Another common sign: emotional withdrawal. Someone nearing the end of life often loses interest in social interactions. You might notice them speaking less, engaging less, or spending long periods simply sitting in silence. It's not that they don't care about their loved ones. It's that their brain no longer processes emotions and engagement the same way. Conversations become tiring, loud environments feel overwhelming, and eventually, many seniors retreat into their own world. You may also notice changes in mood and behavior. Some individuals become more irritable, anxious, or easily frustrated. Others seem unusually calm, detached, or indifferent to things that once mattered to them. This isn't just a personality shift, it's often a result of the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and the person may stop reacting to situations in the way they used to. For family members, this stage can be especially difficult. Watching a loved one lose touch with reality or pull away emotionally can feel like losing them before they're actually gone. But it's important to remember, this isn't something they can control. Instead of trying to bring them back into conversations, the best thing you can do is meet them where they are. Speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, more confused, or less engaged, don't ignore it. These are often early signs that the body and mind are preparing for the final transition. This is a time to be patient, cherish quiet moments, and focus on creating an environment that feels safe, familiar, and peaceful. Because even when words fade, love and comfort can still be felt. Let's move on. Number 4, frequent infections and slow healing. As the body begins to wind down, one of the clearest physical signs is a weakened immune system. You might notice that someone who rarely got sick before now seems to catch every cold, every flu, every small infection that goes around. What used to be minor illnesses now take much longer to recover from. And simple wounds, like a small cut or bruise, heal at a noticeably slower rate. These changes aren't random. They're signs that the body is no longer able to defend or repair itself the way it once did. One of the biggest concerns is repeated infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system weakens. Many families assume these are just isolated illnesses, but when they start happening frequently or take a long time to clear up, it's often a sign that the body is losing its ability to fight back. Even antibiotics, which once worked quickly, may seem less effective. The person may need stronger medications, longer recovery periods, or multiple rounds of treatment for infections that once would have been minor. This happens because as circulation slows and organ function declines, the body simply doesn't respond to treatment as well. Another overlooked issue: chronic wounds. If you notice that small scratches, sores, or bruises aren't healing properly or keep reopening, it could mean that circulation is compromised. Poor blood flow means that oxygen and nutrients aren't reaching the skin and tissues efficiently, making healing much slower than usual. Pressure sores, especially for those who are less mobile, become a serious risk and can lead to dangerous infections if not carefully managed. What's even more concerning is that infections in the final year of life often don't look the way we expect. Instead of a high fever, an elderly person may simply seem more tired than usual, more confused, or less interested in eating. In fact, for seniors, a sudden decline in mental alertness is often the first warning sign of an infection, even before other symptoms appear. This is why recognizing these changes early can make a difference in how much comfort and support they receive in their final stage of life. For families, watching a loved one go through repeated infections can be frustrating and heartbreaking. It's tempting to push for aggressive treatments, hoping that one more round of antibiotics or one more hospital stay will fix the problem. But at a certain point, the focus often shifts from curing to comforting, making sure they stay hydrated, keeping their skin clean and moisturized, and minimizing stress on the body can do more for their well-being than another round of medication that only prolongs suffering. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Number 5. Major changes in breathing or circulation. One of the most telling signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You may notice that your loved one breathes more slowly or shallowly than before. At times, they might pause between breaths, or their breathing might become irregular, speeding up and then slowing down unexpectedly. Some people experience a gentle, rhythmic breathing pattern called Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. These changes can start subtly, but over time, they become more pronounced and more frequent. Another common sign is weakened circulation. You may notice that their hands, feet, or even their nose and ears start feeling cold to the touch. The skin may appear pale, bluish, or mottled, especially around the fingers and toes. This happens because the body is prioritizing blood flow to vital organs, reducing circulation to the extremities. It's a clear indication that the heart is not pumping as strongly as before. Some people also experience more shortness of breath, even with minimal movement. Simply sitting up, speaking, or shifting positions might cause them to feel winded or out of breath. You may notice them breathing through their mouth more often, or they may suddenly need to stop and catch their breath while talking. If they were once able to walk across the room easily, but now struggle to do so, their lung function may be declining. In some cases, fluid buildup in the lungs can make breathing more difficult. This can cause a persistent cough, gurgling sounds, or even a feeling of tightness in the chest. Many people assume it's just congestion from a cold, but in elderly individuals nearing the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to ease their breathing. For family members, seeing these changes can be frightening. It's natural to want to help, to encourage them to take deeper breaths, or to worry that something urgent is happening. But in many cases, this is simply the body's natural way of slowing down. There may not always be a way to reverse these changes, but there are ways to make them more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease discomfort. In some cases, medications or oxygen therapy can provide relief, but the focus shifts toward comfort rather than trying to fix the issue. If you notice these signs, changes in breathing, cold hands and feet, or a bluish tint to the skin, pay attention. These are often indicators that the body is conserving energy and that circulation is slowing down. It's a time to be present, offer reassurance, and create a peaceful environment where they feel safe and at ease. In these final months or weeks, the most important thing you can give them isn't medical intervention. It's comfort, dignity, and the knowledge that they are not alone. Final thoughts. As we come to the end of this video, take a moment to reflect on what we've discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often appear in the year leading up to an elderly person's passing. They may not all happen at once, and they may not always be obvious at first. But when you start noticing them, it's a sign that the body is preparing for its final transition. For many families, these changes can be difficult to accept. It's completely natural to want to push back, to encourage a loved one to eat more, stay active, or push through their fatigue. But sometimes, the most compassionate thing we can do is listen to what their body is trying to tell us. Rather than focusing on reversing what's inevitable, our energy is better spent creating a final chapter that is peaceful, comfortable, and deeply meaningful. Recognizing these signs isn't about fearing death. It's about being prepared. Early awareness allows you to provide better care, make thoughtful decisions in advance, and ensure your loved one's final months are filled with love, dignity, and grace. This is a time to treasure the small moments, to share memories, and to let your loved one know they are seen, valued, and never alone. If you're observing these changes in someone close to you, take a deep breath and remember, you are not walking this road by yourself. Many others have faced this journey, and while it's never easy, understanding what's ahead can bring you strength, patience, and peace. Thank you for spending time with us today. We'd love to hear from you. Please leave a comment and share one insight you gained and how you plan to use it. Your voice matters, and we truly value your thoughts. Reading your comments inspires and motivates us to keep going. If you found this video helpful, please like, subscribe, and share. Your support allows us to continue creating meaningful content to inform and uplift others. Thank you again for watching. We look forward to connecting with you in the next video.